Ladies and gentlemen of the media, wherever you are, Trinidadians and Tobagonians listening on the World Wide Web or on your TVs this morning. Ladies and gentlemen, the coronavirus epidemic, again, as I always say, shows no signs of slowing down. On Saturday, when we were here on Saturday, we were speaking about 16 million cases. Today, which is Wednesday, a mere 5 days later, we are now within touching distance of 17 million cases. We are currently at 16,959,858. It took 38 days for the world to move from 5 to 10 million cases. It took 38 days to add those 5 million cases. To move from 10 million to 15 million took 24 days. So that gives you an indication as to how rapidly this pandemic is accelerating around the world. The world is still seeing upwards of 200,000 new cases per day. So as I said, 38 days to add 5 million cases from 5 to 10 million, and a mere 24 days to move from 10 to 15 million. Ladies and gentlemen, on the local scene, there have been some unfortunate developments which have necessitated that as Minister of Health, I address them this morning. When we move the press conferences from daily to 3 times a week, the Chief Medical Officer would have been excused from several of those press conferences in the past, as he was excused on Monday to attend to a family issue. Unfortunately, there are those in society who interpreted his, I wouldn't say regular absence, but a normal absence of Monday to put into the public domain all sorts of mischievous theories that he had resigned, that he was at odds with the government. It had nothing to do with it. As he has not been here for some press conferences in the past, he was not here on Monday because he had a personal matter to deal with a member of his family. That is the long and short of it. But there's those in society who deem it their business to drag the office and the person that is the Chief Medical Officer into their conspiracy theories. And this comes on the heels of somebody impersonating the Chief Medical Officer and calling the organizers of the Premier League, you'll remember some weeks ago, claiming that Dr. Parasram had altered the quarantine provisions. So there's a lot of mischief afoot trying to implicate both the office of the Chief Medical Officer and the person who is a public officer of the highest repute. And the insinuations against the character of Dr. Roshan Parasram need to be condemned in the strongest manner. So I hope that puts those conspiracy theories to rest. In speaking to Dr. Avery Hines and Dr. Naresh Nandram this morning, and the Chief Medical Officer, it is now my responsibility to bring to the national community, as I did when we had problems with those persons being quarantined, who were refusing to sign their quarantine documents and so on. As we are in this phase of these local cases propping up, where we now have to do significant contact tracing, both Dr. Hines and Dr. Nandram, who are responsible for this, have asked me to bring to the national community and to speak to those persons directly with whom we have to make contact. We are getting a lot of problems recently with contact tracing. What are some of the issues? And we must realize for the country to keep on progressing, we must get the cooperation of all contacts of persons we have identified with COVID-19. One of the issues is that persons are not answering their phones, especially when they realize that the number that comes up on your phone is a ministry number doing the contact tracing. What this means is then we have to expend resources and slow up the contact tracing process by physically driving to a location. That ought not to be. It is a waste of resources, and it does not give us timely contact tracing. We need to contact you as soon as humanly possible so we could trace all your primary contacts, whether it's your family, your close friends, your colleagues at work, to protect them. This is a time for us to realize that when we have COVID, it not only affects us, it is a national issue. The other issue that Dr. Hines excuse me, and Dr. Nandram will like me to raise on their behalf is that questions should be answered truthfully. Not to be too unkind, but on follow-up examinations, we are uncovering persons who are deliberately withholding useful information that, if we had gotten it in the first place, would significantly reduce the amount of time, energy, and resources we have to expend in contacting your secondary and primary contacts. So we need questions to be answered as truthfully as possible, as far as your memory permits. The third issue that both gentlemen asked me to raise this morning is that some persons are being very uncooperative and very hostile with the contact tracers. We understand that some of the questions may be of a private and personal nature, but hostility and hanging up the phone is not the way to go. We understand we may be asking you how long you are living in a particular location. That may be deemed private, but it's important. We understand that when we are asking you who is your partner, your girlfriend, boyfriend, husband, wife, who are your close personal contacts, as far as your position is concerned, it's personal, and it is. But we are in the middle of a pandemic which has affected, what I said earlier, over 16 million people around the world. If we can get the cooperation of those contacts, it means we can trace people quickly. It means the shutting down of institutions could be for shorter periods of time, or not even shut down at all. But we need the cooperation of the persons we are trying to reach via contact tracing. The strength of the contact tracing is heavily dependent on the cooperation of those we are trying to contact and the truthfulness of the answers that we get. So we are asking for cooperation this morning. The third issue I would like to raise before I hand over to Minister Cox is that these local cases that we are getting, and the Chief Medical Officer will expand on it, the localized lockdown measures that we are instituting are basically nothing new as far as public health is concerned. The shutting down or closing of places like schools or business places has always been a part of the public health response landscape for issues like foot and mouth disease in schools. Whenever we have an outbreak of foot and mouth disease in any school, we have shut down those schools in the past. If we have outbreaks of gastroenteritis in a school or influenza, we have done this in the past. So what we are doing now is in keeping with public health measures that have always been a part of our public health landscape. What is heightened now is that we are using it in response to possible COVID outbreaks, which we want to avoid in schools. And the Chief Medical Officer will go into a little more detail as to why we need to have this action of localized shutdown. I just want to close on one other example from around the world to show how different countries are adopting different measures. Imagine you are on a vacation and you are in the air coming back home after spending your vacation. And in the air, and when you reach in the airport, you understand and you learn that your government has now said that once you disembark from that plane, you now have to quarantine for 2 weeks. When you left to go on your vacation, that was not government policy. This is the reality that is facing many countries. England imposed that recently. And their citizens who went to Spain on vacation, when they were returning or in Spain trying to come back or landing in airports like Stan said, they were told that government policy has changed literally overnight. And you are now to quarantine for 2 weeks. The point is, different countries are adopting different measures. Some very serious, some could be considered draconian. We have had our period of 3 months of lockdown, and what we are doing now in managing these local cases that pop up is a series of strategic surgical strikes by locking down individual places of business and or schools. But we need the cooperation of persons who I've attempted to explain when we are contacting you to please, 1, answer your phone, 2, answer your questions as truthfully as your memory will allow, and 3, the questions are designed to limit exposure. We need to know who your primary contacts are. We need to know who you have been in close contact with. And that is the reason for asking the types of questions we unfortunately have to ask. So, Minister Cox, those are my 3 interventions this morning as we continue to mount a robust challenge, a robust response to our new phase of COVID, that is these localized cases that are propping up. And I want to thank you for the opportunity to be here this morning.
Thank you very much, Minister. At this time, the Chief Medical Officer, Dr. Roshan Parasram, will provide us with a clinical update. Dr. Parasram.
Good morning, Honorable Ministers, members of the media, members of the viewing and listening public. My clinical update for Wednesday, 29 July 2020 is as follows. The total number of tests done in the public and the public sector and the UE and the CARFA lab are 7,068 at this time. Total number of unique patient tests stand at 5,395. Total number of repeated tests, 1,560. Total number of tests done in the community, 2,974. Total number of private sector tests, 1,789. Total number of public and private sector tests combined are now at 8,857. And the number of positive cases now stand at 156, with 2 additional cases yesterday, which have been linked to previous cases in the recent past, as well as 1 new case early this morning at 8:38, where we had another case that was linked to possible cases that came before. The contact tracing has just begun on that case. With regards to the number of deaths, they remain at 8. Total number of patients at the hospital are 19 at this time, split between the Cora facility, which houses 18 individuals, and the Couva Medical and Multi-Training Facility, which has 1 person. The person that was in HDU at the Couva facility has now been stepped down and is improving into a ward setting. In terms of the parallel system, therefore, we have COVID positive 20 persons, with the last case now being en route to the Cora facility, and 179 persons being quarantined throughout the various sites. So in terms of quarantined individuals, we have at the Cora facility 2 persons. At the UE St. Augustine Day Bay campus, we have 24. At the Chancellor Hotel, we have 13. At the Napa, we have no individuals at this time. And at the Cascadia Hotel, 49, Tacarigua, 21, Homer Football, 47, and Regent Star, 23. In terms of the contact tracing and continuing update as it relates to that, at this time, we are continuing our contact tracing on all the new cases, including the last one, which we just got about an hour ago, and monitoring closely by the CMOH's offices to ensure that quarantine and isolation and the necessary testing occurs as needed. It must be noted that during our contact tracing exercises, which have been going on in the last couple of weeks, we have reason to believe that a person or person from that group had been in contact with individuals who have recently managed to cross our borders. We are relying heavily on the clinical history given to us by patients and their contacts. In some circumstances, we understand that there may be difficulty in recall. In order to assist, as Minister has indicated, with the ongoing tracking exercises, we ask patients and their contacts to be as forthcoming as possible with all information. In light of our recent findings, remembering that our last case, 116, was on April 20th, and our first new local case was detected on July 20th of July 2020. This is likely to be the start of a new phase of COVID-19 infections in Trinidad and Tobago. At this time, our main goal in the ministry is to continue to limit the spread of this disease through rapid contact tracing, quarantine, and testing of all affected individuals. In this regard, I would like to take the opportunity to remind the population of the requisite guidelines that are already prepared by the ministry and available on our website at www.health.gov.tt. These guidelines are inclusive of the guidelines for business facilities and institutions, annual general meetings, places of worship, gyms and fitness centers, cinemas and theaters, and restaurants and bars. Just to go into a little more detail with regards to as Minister has described, our key component is contact tracing, testing, and ring fencing as many persons as possible. So we are doing primary, secondary, and tertiary contacts at this point. If, of course, a primary contact becomes positive, then the secondary becomes a primary, the tertiary becomes a secondary, and we widen our net as wide as we can. You have seen the closure of 3 schools so far, a number of business places. There has been the closure of the Riverside Plaza TTPS and some floors of the administrative building as well. We will continue to close as many places as necessary, and the reason we close basically is to limit exposure. We sanitize those places, and of course, if we get the negative test coming back from the persons that would have interacted, we therefore communicate to reopen those facilities in the shortest possible time. Let us remember that the first phase of this epidemic began in Trinidad and Tobago on March 12, 2020. It was accelerated by the influx of approximately 20,000 persons coming through our airports and seaports. The first phase lasted 5 to 6 weeks. I believe with strict adherence to our public health measures and recommendations, we can once again control the spread of COVID-19 in Trinidad and Tobago. Thank you, Minister Cox.
Thank you very much, Minister. We are happy to have with us today the Minister of Social Development and Family Services, the Honorable Camille Robinson-Regis, who will give an update on the government's social services response to COVID-19. Minister Regis.
Thank you very much, colleague. Good morning to my colleagues, Minister Singh and Minister Cox.
Good morning.
Good morning to the citizens of Trinidad and Tobago and those who may be watching us live or who are viewing or listening to us via various social media platforms. Members of the media, good morning. I welcome this opportunity to update you on the response of the Ministry of Social Development and Family Services in the wake of the coronavirus pandemic. Ladies and gentlemen, notwithstanding the challenging economic situation in which we found ourselves as a government and a people, we have held steadfast to the promise to leave no one behind, ensuring that for the most part families were protected and well cared for during this challenging period in our country's history. This, I can assure you, was not an empty promise. As of today, the ministry has expended close to $284 million on a number of initiatives which have impacted the lives of more than 156,289 individuals and families, representing over 450,000 persons, or approximately 1/3 of the national population over the last 4 months. There are 2 categories of persons who have benefited from the ministry's intervention: those who were already on our databases and in receipt of some form of government assistance, and those who, as a result of the COVID-19 pandemic, found themselves unable to adequately provide for themselves and their families. As at today's date, I can assure the population that the ministry has continued to provide support to more than 170,000 individuals and families whose major and in some cases only form of sustenance came in the form of senior citizens pensions, public assistance grants, disability grants, food support, and other support services. I am proud today to report that these grants were all paid on time and in the correct amounts. In a direct response to the COVID-19 pandemic, the government of Trinidad and Tobago increased the value of the food support, public assistance grant, and the disability grant, thereby putting more financial resources into the hands of the most vulnerable families in the country. For example, the ministry provided a top-up to 25,101 existing beneficiaries of the food support program at a cost of $17.1 million. A top-up was also provided to 17,834 existing public assistance beneficiaries at a cost of $11.4 million. 24,627 existing persons with varying disabilities, including 1,535 children, benefited from additional financial assistance. The expenditure associated with this measure was $11,082,150. With respect to those persons who were directly affected by the COVID-19 pandemic and found themselves unable to adequately support themselves and their families, the government rolled out a suite of initiatives. These included 20,500 food cards, which were delivered to all members of Parliament for distribution to families with a child or children registered with the school feeding program of the Ministry of Education. That expenditure was $31.4 million. 2,818 applicants of the senior citizens pension whose applications had not yet been processed were provided with an interim relief of $1,500 per month for a period of 3 months pending finalization of their applications. That expenditure was $12.7 million. 488 applicants of the Disability Assistance Grant whose applications had not yet been processed were also provided with interim relief of $1,000 per month for a period of 3 months pending the finalization of their applications. The expenditure associated with this measure was $1.5 million. The ministry implemented an emergency hamper distribution initiative in collaboration with the Disaster Management Unit of each of the 14 municipal corporations across Trinidad. This was supported by a dedicated call center at the ministry. In this regard, 1,400 families benefited from this initiative, and the expenditure associated with this measure was $500,000. By far, the most significant cost incurred by the government in this exercise has been in providing temporary income and food support to persons who were either retrenched, terminated, or experienced reduced income. To date, the ministry has provided support to 42,813 families. When this is disaggregated, 41,165 families received food support by this measure, and 39,804 received income support. More than 38,000 families received both income support and food support. The total expenditure associated with these measures so far is $185 million. Ladies and gentlemen, recognizing that some citizens would have been unable to pay their rent as a result of their retrenchment or reduced working hours or reduced income, the government undertook to provide rental income assistance to those affected persons. To date, 95% or 6,280 of the 6,806 applications for rental support have been processed. To date, we have already called in over 3,072 landlords to receive their payments. The expenditure thus far is $8,732,800. Unfortunately, for varying reasons, 1,632 applications have been rejected because a number of those applications were either without proper documentation or were not completed effectively, or were an attempt to scam the government. So those applications were rejected. As a means of ensuring that the nation's farmers also received some benefit, the ministry collaborated with the Ministry of Agriculture, Lands and Fisheries to distribute hampers to 30,000 needy families. Recipients received a 500 valued hamper which contained a supermarket voucher and a box of locally grown fresh fruit, vegetables and chicken. There was a voucher of $250 so that persons could go to the supermarkets of their choice. To date, over 21,000 families have received hampers, and the expenditure to date is in the order of over $10 million. In its effort to ensure that no citizen or permanent resident or other persons were excluded from the safety net, the government went a step further and partnered with faith-based organizations, which were already engaged in similar exercises of providing hampers for distribution. The expenditure for this has been agreed in the amount of $30 million. Thus far, we have expended $10 million and 85,000 families have already benefited. We use the umbrella bodies of these religious organizations, and that was 66 umbrella bodies. We did find, though, that there were smaller organizations which were not captured by these umbrella bodies, and that was organizations in the order of 83 smaller organizations. So all these organizations have in fact benefited from this grant from the government to the faith-based organizations. Unfortunately, ladies and gentlemen, even as we report on the initiatives undertaken by the government and the excellent responses we have had from the hundreds of thousands who have benefited in one way or another, we must also acknowledge the challenges we have faced in delivery. It is often said that crises bring out the best and the worst of people, especially when there are human systems and human beings involved. There is always the possibility of some persons demonstrating what is less than authentic in themselves. To this end, we have found that there may have been over 3,000 persons who may have attempted to receive both the salary relief grant, which is through the Ministry of Finance, through the National Insurance Board, and the income support grant that was designed by the Ministry of Social Development and Family Services. If in fact it has been found that these persons were trying to do what is double dipping, we are doing a verification exercise to ensure that there has been no such duplication and the persons have not in fact been able to benefit from the income support grant and from the salary relief grant. But we are in the process of making sure that this has not happened, and we will report on this further after complete investigations have been done. The second challenge is the failure of some applicants for the salary relief grant, for example, to properly complete the forms before submission. We have discovered that very often when a person takes to social media to complain about their inability to receive their grants, the fault lies squarely on their shoulders. A perfect example can be found in the case of Mr. Sheldon Aberdeen, who in a social media post noted, and I quote, "We complaining too much. It's time for action. Anyone willing to protest, we sure to get what's rightfully ours." We saw this post because, as you know, we also have our Facebook page. In an attempt to deal with Mr. Aberdeen's application and to ensure that Mr. Aberdeen's application was properly dealt with, I asked the ministry to investigate that matter. We subsequently found out that Mr. Aberdeen's application for the salary relief grant was one of those being queried. At the time of his submission, he did not submit a copy of his ID card, nor did he submit documentary evidence of his household income. The ministry has been attempting to contact Mr. Aberdeen since June, but without success. Mr. Aberdeen, if you're listening, please contact the ministry and give us the documents so that you will not have to protest, because your protest will be totally unfounded because you have not submitted the documents that you were asked to submit. I want to take this opportunity, therefore, to urge citizens to be honest in their applications. You cannot receive grants for loss of salary or reduced salary from both the NIB and the ministry. That is dishonest and it is illegal. Additionally, if there are still persons filling out forms, please ensure that you supply all the information that is required so that the applications can be expedited. Failure to do so will result in the applications being rejected. Ladies and gentlemen, none of the successes we have achieved would have been possible without the sterling efforts of the entire staff of the Ministry of Social Development and Family Services and the staff of the Ministry of Finance and, of course, other essential workers, including staff of the Ministry of Health. When I addressed you last, I made a call for unity, compassion, and patience as we went about the business of finding the most vulnerable in the country. and providing them with the assistance that was necessary to aid them through this unprecedented period. As Minister of Social Development and Family Services, I want to express my own gratitude and that of the government, for we have seen extensive evidence of the caring that still exists in our beloved country, irrespective of which side of the religious, political, cultural, or even ethnic divide you stand. In this situation, we have one common purpose: to ensure that no citizen goes to bed hungry, no child is deprived of a meal, that no parent is unable to put food on his or her table. We have as a country demonstrated time and time again our resilience as a people, and this time is no different. I urge us to all continue to listen to the urgings of the Minister of Health and the Ministry of Health and the CMO, because together we aspire and together I'm certain we will achieve. Thank you very kindly. Thank you, Minister Cox.
Thank you very much. At this time, it's the media's turn. Members of the media, the floor is now open. Remember to identify yourself and the media house you represent before posing your question. We want to give as many of you an opportunity to pose questions to us, but that means in our limited time, we will have to give each media house a chance to get a maximum of 2 questions in. And once we have completed the pool and time allows, I will come back to you. So let us keep this in mind as we begin taking your questions. Guardian Media Limited.
Hi, good morning, everyone. You all hearing me?
Yes,
Good morning, yes.
loud and clear. Thank you.
All right, morning, everyone. Rashad Khan, Guardian Media. Before I ask my 2 questions, I would just like to request if Minister Robinson Regis could forward that breakdown of all the finances for the relief to us as journalists. And so now on to my question. First question is for Minister Diyal Singh. So I know you addressed and said that we are using targeted lockdowns and strategically doing so. But a large number of the population is wondering the rationale behind it, because early on in our experience with the pandemic, we were only having imported cases, but the country went on a national lockdown. And now when we are seeing the possibility of what we are hoping is not community transmission, they're wondering why it is that this same measure isn't being applied. So I just want an explanation behind the rationale. I know on Saturday you said that we need to learn to live with the pandemic, but just a bit more clarification if possible. And the Chief Medical Officer, you indicated that one of the cases of local spread that we've seen is someone who had contact with someone who entered into the country illegally. Now, I just want to find out how successful has the ministry been in tracking down that contact which the person would have had, that illegal immigrant, and also if it's the person that we are thinking about that it may be who had that contact, is there any sort of action that is going to be taken against this person for, like the Minister of National Security said, harboring or assisting illegal immigrants in the country?
Okay, thank you very much, Rashad, for that very valid question. So let's go back to the early days when it was not a pandemic, when it was just a cluster of cases in China. And on January 30th, when the Ministry of Health would have sent a note to Cabinet, so our first action was to actually stop the travel from persons from China. You must have been out of China for 14 days or more. Then we had the closure of the borders, I believe, around March 23rd, around there. And on that occasion, Rashad, 19,583 persons would have come in by midnight of the Sunday night. And then the lockdown of the country would have started. You would lock down your country for several reasons. One, to keep those 19,000 odd persons who came from abroad, who may have or had the virus, from causing widespread community spread in Trinidad and Tobago. You will also lock down to get your testing capacity up to speed, to get your parallel healthcare system up to speed, to to make sure you have PPE, to make sure you have personnel, so you lock down to stop the spread of the virus and to get your contingency plans up to speed. Countries around the world, and we have said this, countries are now in the phase where they have to learn to live with the virus. And when we started the phase reopening, we always said at every phase, we are going to be careful, we are going to manage this strategically and take it one phase at a time to prevent, and these were my words, the slingshotting back into the pre-lockdown phase. To continue to lock down a country forever or for the foreseeable future will create many more problems than we are trying to solve. The countries around the world that have been successful in reopening their economies are now in the phase where we always expected these local cases, and to keep our economy going, to keep people employed, to keep everything going, we are now in a phase with these local cases, few in number, but if we don't lock down the strategic positions like schools and business places, that has the potential to snowball. And the Chief Medical Officer can go into more details, but that is the basic strategy behind going with a strategic lockdown now versus a total economic lockdown, which will create more problems than it solves.
Okay, the second question to the Chief Medical Officer.
Okay, so with regards to your question, we have been working very closely with the Ministry of National Security. We will share with them whatever information we have, bearing in mind that, those persons need to be contacted for the reason we have to ring fence whoever it is, or persons that have been in contact there, because the plausible argument is that they would have been positive prior. So it is an area of spread and is a risk to spreading to more persons in the community. We need to find out through national security and other avenues where those persons or person may be, find that individual, test, treat, and then ring fence any other contacts that may occur. If you just look quickly at the graph, I just wanted to go into a little more detail briefly. This is the graph of COVID-19 cases in Trinidad and Tobago, cases per day. So starting on the left-hand side, we would have noted our first case on the 12th of March 2020. The big peak is where we would have had 40 individuals, if you all recall, from the swabbing of persons coming in from the Costa Fabulosa, which is a cruise ship that came in as a group of 73 individuals. Eventually over 52, I think, persons tested positive from that group. That was the first cohort of 40 with the high peak in the blue. The other bits between March 12th and April, just after April to the end of April, we are seeing the majority of what we are calling the first phase of the epidemic in Trinidad and Tobago. We may see one or two infections occurring in May. Those in May were imported in terms of way of repatriation of individuals and would have come out of the quarantine facilities and therefore had no impact on the population. What we saw with our first case on the 20th of July, which we still have deemed as local spread for now, is we have seen sporadic spread in between. There are 3 or 4 cases that occurred there again from repatriation of persons, so they would be imported. So to the most part, I think there would be 5 truly local, 3 to 5 local cases that we are seeing. And right now we are contact tracing every one of them, going all the way to primary, secondary, tertiary, because we need to get that cluster, decrease the likelihood of a local case becoming a cluster, and then of course a cluster of cases coalescing to become community spread. So bearing in mind, if you look at the graph, carefully taking away the 1 case in May, there's clearly 2 phases setting up. The second phase is much less organized in the way it is coalescing. So you have gaps in between. Therefore, we continue to be classified as sporadic by WHO. So if you can notice on the graph, there's 1 case occurring, then there's a skip of 2 days, and then there's another case. Yesterday, we would have received 2 cases which are linked to other cases, and we found, because we actually were able to successfully contact trace outwards from our primary cases to secondary cases, and when we tested those, we found those to be positive. So, Minister Cox, back over to you.
So before we go back to Minister Cox, if you could put that graph up, because that further explains in graphical format what I have been trying to say orally. If you look at the left-hand side of the graph and compare it with the right-hand side, you could see where the left-hand side, it necessitated a national response. But if you look at the right-hand side now, you could see it is not, the numbers are much less, they are spread out. So we have these local cases, which in our view at the Ministry of Health, and we have discussed this with the Chief Medical Officer, it does not necessitate the type of action that we instituted at the initial stage, where you had those clusters of cases, where those blue towers are so close and jam-packed together, it looks like the New York skyline. But if you look on the right, we don't have that type of aggregation or clustering of cases. So I think that graph explains it brilliantly. Thank you very much.
Thank you very much. 98.1.
Very good morning to the panel, ministers, CMO, Stephen
Morning.
Cummings, 98.1 FM. I want to address two questions, one for Minister Camille Robinson-Regis and the other for Minister Dayal Singh. I'll go first with Minister Camille Robinson-Regis. Minister, you are a former Minister of Planning, Planning and Development, now Minister of Social Development and Family Services. Would we see sometime in the future, or could we see a detailed study as to the real impact on the social implications of the society as we witness the thousands of citizens returning home at this time? There is going to be some kind of socio-economic impact, especially post-COVID-19, on the overall economy. And it speaks not only to financial disbursement from the ministry, but also a bearing on our health services, housing, jobs, as well as even education. And Minister Dayal Singh,
yes,
you have expressed the critical importance of solidarity in this fight, to suppress and manage our caseload of COVID-19. As of today, we are at 156 positive cases, and undoubtedly communication is going to be a key element in this dynamic. On the question of communication, the police commissioner appears to be very much concerned yet again about what he believes to be gaps and a disconnect with the flow of information between officials of the ministry and the TTPS. And there was a press conference that he had earlier on this week. He hints at a breakdown of communication between your office and the office of the CMO and the TTPS. The commissioner was very clear this week at the police news briefing. Is there, are you able to speak to that issue in terms of that that flow of communication between your office and that of the TTPS?
Sure. So let me go first. There was one phone call which I neglected to return to the Commissioner of Police, and for that I humbly apologize. I should have returned the call as I normally do, but this weekend gone was a particularly challenging weekend. We had several projects ongoing, and I do apologize for not returning the Commissioner's call. However, the TTPS is included in all our discussions via the Chief Medical Officer's chairmanship of a cabinet-appointed committee where all agencies responsible for the COVID response meet virtually. In the early days, they used to sit around a table. So the views of the TTPS are always considered, and the lines of communication between myself and the Commissioner via the Ministry of National Security have always been open, but there was one call this weekend which I neglected to return, and for that I humbly apologize. Thank you very much.
Thank you. Minister Robinson-Regis.
Thank you very much for that question. Let me indicate from the outset that the Ministry of Social Development and Family Services has already been collating all the information that is necessary with regard to this experience of the COVID-19 and what we anticipate will be the issue, all the issues going forward. In addition to that, we have already been speaking with UN ECLAC and the IDB, who have indicated the need for research and indicated that there will be a definite move in that direction as we collate the information. We have been speaking with the various stakeholders to complete a comprehensive impact assessment moving forward. And in addition to that, that will work with us through the next phase, which is planning for how we deal with these issues in the future and planning for how the social sector will move its issues forward. So that is the circumstance. We have already started putting research in place because we've been collating the information. Thank you for the question.
Thank you very much. 91.9.
Hi, good morning, everyone. We're next to 91.9 FM. Just 2 quick questions. Minister of Social Development, what is the procedure to inform persons who had not been selected to receive their grants? We are still getting a number of calls, messages, and contact from persons that they haven't gotten the grant, they didn't get through as yet. Is it that they are not getting any response in terms of whether it's negative or positive? And Dr. Parashram, could you give us an idea to how do you think the contact tracing is going at the moment in terms of the response? Do you think we are making fair progress in fair time, or are you concerned that we could have a continuous, emergence or, increase in the number of cases that we see? Or are you comfortable that the contact tracing has gotten us to a point where we have this particular phase under control, if that is possible to say at all? Thanks.
Okay, Dr. Parasram.
I think we early on in the second phase. The contact tracing for our known contacts are doing very well. As I said, we had primary, secondary, and tertiary. Yesterday, we were able to actually get results of persons we swabbed, not because they presented a facility, but because they were home quarantined as a result of interventions from contact tracing. And we got positives from those individuals, meaning we were able to track them and hold them very well. So there's no further spread from that particular person or persons. So I think the contact tracing is going well for the few cases that we have thus far. Having said that, and we have always described the phenomenon of hidden contacts, as I discussed before, persons who were ill, moving about, and going to a supermarket, for instance, there could be a contact with someone that you would not have known for a brief period of time, more than 15 minutes, more than 10 minutes, or through fomites, which are respiratory droplets going onto a surface where someone touches it before you, and then you take it into your respiratory system. So those hidden contacts are always the sort of outliers in any epidemic that we cannot cater for. And really and truly, what we have to look at is the primary, secondary, and tertiary contacts, the way those persons are becoming positive. And then it tells the picture of what will happen with hidden, because primary, secondary contacts are those people who would interact with a case for greater lengths of time and in greater depth. So if those persons remain negative, bearing logic remains that the hidden contacts are less likely to become positive. So we are tracking what we know, but the hidden contacts become what we are concerned about and what can lead to clustering and community spreading.
Thank you, Minister.
Thank you very much for that question. We have been sending both SMS, text messages for both approvals and rejections. We have also asked persons, if they have not heard from us, to call 800-1673. Tomorrow, in all the newspapers, we will have an ad out indicating that if anyone has not yet heard from us, they can feel free to call us and to call the call center, and we will be giving those numbers. But what we have done is send text messages once the person has given a telephone number, and that is why we asked for the mobile numbers when the application forms were being done. Thank you for the question.
Thank you very much. TTT?
Good morning, Crystal Wilson, TTT Limited. 2 quick questions. I've noted that the CMO has said the country is entering a new phase of the COVID-19 pandemic. With the increase in numbers daily, and with 3 schools now closed, Is the Ministry of Health prepared to advise the Education Ministry on perhaps delaying the reopening of school? And my other question is anyone able to give us a figure of how many people are so far affected or compromised by the possible exposure? This is regarding the institutions that are currently closed.
Minister?
So let me take the first question. Anything to do with schools will be a policy decision. The Ministry of Health, if asked by any system ministry, will provide any technical and or medical advice needed for that ministry to make a decision. As we stand right now, the Ministry of Health, to the best of my knowledge, has not been approached by the Ministry of Education to make any decision as to schools. Right? So I hope that answers your question. Thank you very much, Crystal.
CMO?
Yeah, so as I said before, when we were, just take one case for example, once you affect schools, I had said before on air that there were 90 primary contacts and upwards of 200 secondary contacts, and then the numbers go up as you look at workplaces and other institutions that are being affected. You saw closures of the TTPS building at Riverside yesterday. So the numbers are growing in terms of possible contacts, but as we go further out away from primary, the primary contacts are at greatest risk of contracting the virus first. So those numbers, I would say, are at present in the hundreds, and secondary and tertiary go beyond, but the primary contacts are our first consideration, bearing in mind that all primary, secondary, and tertiary remain locked down for the full duration of the 14-day period to ensure there's no further spread from those clusters.
Thank you. TV6.
Hi, good morning. Alicia Boucher from
Morning,
TV6. Good morning. I wanted to get some clarification as much as possible without revealing confidential information. Based on that last case this morning, it would have stated that one contact had COVID-19, had contact with COVID-19 patients. Is it that this contact was aware that they would have had contact with COVID-19 patients before and then may have been in quarantine, or is this person a person that was moving about? That's my first question. And the second question is, the minister would have stated that based on the graph, we saw a cluster when the country was under lockdown, but that cluster would have been managed as those were imported cases and state quarantine was mandatory. But now that we are seeing localized cases where that quarantining period, that isn't, well, persons may not have necessarily been in quarantine, which may seem more dangerous as opposed to where it was controlled. How are we weighing that in terms of deeming the first necessary but not this one?
Okay, so I will go with the second part first. We managed this thing from day one when we had phase one reopening. We always said it's a matter of how much risk you are willing to take on. Risk in terms of your ability to treat with the cases. The parallel healthcare system at this point in time has capacity to deal with this inevitable, predicted, localized caseload. For instance, Cora has currently 18 persons, but we have 100 beds there. But even if we only use 75% capacity, as we always said, we are still underutilized. In Couva, we have 175 beds, but we only have one person there. So the action to shut down the country again is one which has to be taken very seriously, because, as we said before, that creates a whole set of other problems, foreseen and unforeseen. The economy has to reopen. We have to learn to live with the virus. And what we are doing at this phase is living with the virus, but we are asking the population to play their part in adopting the public health measures, which is wear masks, stay home if you are ill. this recent cluster could have been so minimized if persons who were ill or knew their children were ill would just have stayed home and get tested. So this is the mantra going forward. People have to live, people have to work. We have to learn to live with this virus until there's a vaccine or until there's some therapeutic agent to treat it much more effectively. So the risk we are assuming now in the parallel healthcare system with this caseload, the number of cases we are treating now, we have more than enough capacity to treat with it. But what we need, as we said, is the solidarity moving forward from the population to adopt the simple measures: wear a mask, hand sanitization, stay home if you are ill. And what I would like to ask business persons to do, and some are doing it, in addition to no mask, no service, all business persons should, as far as humanly possible, especially factories, factories where people are working for 8 hours a day, offices, to do the fever testing with the handheld scanners, which gives you an idea of anybody coming into your premises actually have fever. That will go a long way. So these simple public health measures will help us manage this next phase of the virus so that we don't have to shut down the economy again and send thousands of persons onto the breadline and create a whole set of other socio-economic problems. So I hope, Alicia, that does answer your question.
Thank you. CMO?
As I said, we just got that last case after 8:30 this morning, so our primary goal is to get that person transferred safely to the hospitals. And then, of course, our contact tracing will begin right after to determine where the person would have contracted it, who they would have been exposed to, etc. So that will happen and has been happening as soon as we get that person safely into the hospital, where the clinicians can actually take a detailed history to find out all that information. And once again, we're just making a call to anyone that has interacted with our contact tracing by phone or otherwise. Please be as forthcoming as you can. Try to recall as many instances where you would have had interactions in the few days leading up to your illness.
Thank you very much, CMO. Many hands still up, members of the media, but we have come to the end of today's virtual media conference. Okay. Do remember that the Ministry of Health and the Ministry of Communications are your only credible sources of government information on COVID-19. And as we go, I want to again appeal to you to wear your mask. It is important that we set the example that wearing a mask is the right thing to do during a pandemic. The recent cases in Trinidad and Tobago reinforces that we need to do all in our power to protect ourselves, our families, and the wider population. I wish to remind you that masks offer us protection and is symbolic to those around us that we care about them. We cannot overemphasize how important it is to follow public health guidelines. And please, if you are sick, stay at home. If your children are ill, keep them at home. If you run a business and you are ill, stay at home. Please isolate yourself from your family if you develop symptoms of COVID-19. You can call the hotline 877-WELL or 800-WELL for further guidance. If you are severely ill, call 811 or call ahead to the Accident and Emergency Department of the hospital nearest to you for help. Go in immediately. Let us be responsible and lead by example by wearing our masks and following our simple but effective public health guidelines. I am Donna Cox, Minister of Communications. Thank you for joining us today as the government continues its efforts to keep the curve flat and beat COVID-19. Stay safe.